Hey everyone, hopefully you can see that all right. I'm Jake Campbell. I'm the data manager for the San Bernardino County Public Health Department. I oversee our research assessment planning team, which includes our epidemiology group and our statistical analysts, as well as our GIS team. And so we've been doing a lot, obviously, in the COVID time period for the department and kind of innovating along the way. I'll talk a little bit about some of the different changes we've had in kind of our evolutionary process with some of the kind of lessons learned about what we've experienced in our process. So I think one of the things that's important about innovating kind of in a crisis, and COVID is one of those special cases where there's really no bad opportunity to innovate in a crisis, especially something like COVID where we never had anything prepared that was going to be able to handle this, which really gave us a lot of opportunities to kind of start from scratch. I think one of the challenges with innovations is that the old way of thinking is easy when you've done something time and time again in a particular fashion, and when something comes along like COVID and kind of breaks that model where you just don't have anything that works, there's no choice but to innovate. So that really helps a lot. I think the other thing is that a crisis is a good opportunity where you are stretched for resources, you are stretched for bandwidth, and so I think any opportunity where you can invest in innovation to be able to get to the point that you can save time, share more information, you can do things better. I think, when you're not in a crisis, it's a little harder to maybe sell that because things aren't so timely or pressing. And so one of the things we did is really starting small with particular applications. So when we first started with COVID, early at the county level, we had a situation where one of our data groups, our analytical groups, was producing a PDF table of some summary numbers, sharing it via an email, and then twice a week on a conference call, we're reading those numbers out to everybody who had an interest in knowing what the situation was. And so this was the very first dashboard we created. And so basically, I like to call them like a micro innovation. It wasn't really a big thing. We weren't trying to overhaul the whole process. We just said, there's some basic information that everybody's asking for. It's all coming from a PDF, and we spent a lot of time sharing that document around. Can we look at converting that into a simple thing that we can make public so that everybody in the department and in the county leadership is able to find it easily, so that we can, not have to really worry about all these emails and calls where people want to know the same numbers. And so it was a really low risk investment. I think that's part of it. Was we always had the PDF document to rely upon in the Excel version, should people be comfortable with it. But there was kind of a low risk investment in creating that. So we started with something small that really prompted the abilities to prove that there was value in innovating and doing something a little bit differently than what we've had. So from there, I think the point that we took next was, we had this small innovation. People became really bought in on kind of the basics of that thing that we created. And our simple dashboard was something that people referred to a lot. And so what we did is from there is we started to look at different use cases and opportunities to expand. And so it was multiple micro innovations in such a way that there was a new opportunity. And so this map was one that we created. We were trying to develop a plan for where we should put our different test sites and where we had different facilities who would do COVID testing across the county. And so we started with a work group, and so everybody was making a very long list on a piece of paper. And they were writing down the city names and the different facilities of where all the different clinics and hospitals were, and the different possible areas, the neighborhoods that might have COVID cases. And so we saw an opportunity there to say, well, there's an easier way to do this. And I think rather than looking at a list, because most people kind of were familiar with kind of the spatial landscape of our county, we said, well, let's get you a map, and what we can do is we can give you the prioritization scoring system that we came up with, where we took things like how many cases there were, the prevalence of testing already in that area, right? The underrepresented population counts, vulnerable population information, scored our different neighborhoods, and that's what you see here with the darker red being more high priority testing areas, and then integrated the information we had about the different places that could do testing. And by doing that, right, what we did is we took these really kind of targeted areas that were, I think, high value innovation areas. So, there's a lot of places you can innovate and create deliverables where, they might not be used that frequently. But in this situation, we were looking at an opportunity to really take something that we knew Right? We were going to constantly be looking about where we were going to put our testing facilities. Everybody in the county was concerned with expanding testing and finding places to do testing, wanted to know where it was. And so we really took advantage of that because we knew this was going to be a thing that was referenced over and over again. And so it was another good place to innovate because it was this kind of mission critical application that was going to be something that was used quite frequently. Right? Once we got to that point, we had kind of embedded some of our innovations well enough that there was a number of things that people had bought in on and really were at a point that they were starting to use very routinely. And so from there, our team was focused on kind of refinement and maturation of what we had made, right? So we started with something small, we saw opportunities to improve it. And so one of the things that was critical was, in epidemiology, some of the 3 core elements of what you should be worried about are time, person, and place. And so what we started with was a very basic dashboard, right? But we used that kind of guiding textbook principle of, time, person, and place to guide everything that we did, right? So somebody would want to know information, new information about testing. And so we would take testing and think about, okay, well, what about the time of testing? What about the person of testing? And what about the place of testing? And by going through that kind of process, right, we would refine the dashboards we had, we'd provide new information. And so these visualizations are the current version of our master dashboard that really looks at, we've taken some very basic information like how many people were in the hospitals. And so we've expanded it over time and really continued to refine and improve. Now we're tracking, the state of California has county level metrics with particular target reference points for what would be a good or a bad circumstance. And so we've developed in the upper left corner here kind of a dashboard that tracks those 5 predominant metrics on ICU bed availability, ventilation usage, percent positivity, case rates, and hospital census. And so we've got these performance measures that are tracking against the state standards day by day that people are now comfortable using and comfortable seeing. And the other visualization shows kind of our deep dive dashboard into hospital census. And so as we've got new questions that have come up, because we started with that small dashboard, we've been able to expand it as, people are relying on the small dashboard and the basic innovations that they want something else and something else. And so we've been able to build on that once we kind of got that foothold early on to expand further and further and further. So, one of the things I think that's been an important lesson for us is that there's a good kind of leadership matrix out there that talks about the difference between urgent and importance. And so a lot of the stuff that we were doing, people wanted numbers from us, they wanted information, they wanted it quickly, right? So it was urgent. But doing that required a lot of kind of tedious manual process to be able to just generate the number each day in either an email or a data table or something like that. And so, while we had the opportunities and what little downtime we had, we really prioritized what would be high value investments for us. And so that, right, expanding the dashboard was an innovation that was important because we knew that by making time for it, we were able to take a lot off of our plate, share more information, build in some automation and some process improvements that would basically make it easy for us to get more people to use this new investment, this new innovation that we had made, and be able to sustain it long term so it became a normal part of our operations. So, it's not always easy, but sometimes knowing where to invest time that's going to have kind of the long-term impact on your operation and have the most kind of return on investment and prioritizing those and making time for them, I think is one of those important points. And then I think lastly, embracing change is a critical element of it. So, we started with a small dashboard and a few maps, much like everybody else, new opportunities arise themselves. Now we're in the process of deploying a whole hub site. And so we're standing up, what used to be just a single page view dashboard turned into a 12 view single dashboard, which is now going to be a 15-page hub site with its own dashboard embedded, dashboard for death and a dashboard for hospitalizations and a dashboard for ICUs, right? Because there's more and more information that the public wants, that the media wants, that our leadership wants, and those types of things are, right, expanding further. And so we're making now dashboards with maps on a page, and really people become comfortable with this new way of kind of doing things that we're able to build all of that into a site that now, that they like the navigation, they're familiar with what they're seeing. It's no longer really, it's not quite as innovative because they're comfortable with it, and now it's something that is just a regular part of what they ask. And so, we're constantly getting calls. There's this new information. Can we build this into the dashboard? Can you get us a map? Right? We want to know the next thing. We started to use Survey 123. The state had a really good daily reporting survey for our skilled nursing facilities that was using Survey 123 to collect information on cases at individual nursing facilities. So the upper right visualization there, we actually have maps and visualizations that use that data that's coming in every day automatically from the facilities reporting, and it's actually tracking the change in reported case activity at these facilities so that it can register alerts to a task force that we have that can see, there's new staff or there's new residents at X facility since yesterday that basically have new COVID cases. Here's where they are on a map. Here's their contact information. Go out, see what they need to be able to help control it before the outbreak spreads. The lower right picture there, we also started to expand some of our integrations. So we were using some Tableau applications as well, building different dashboards. We've been able to embed those into our Esri Hub page so that people can quickly something that they used to get in an Excel table, we recreated in a format that looks like a dashboard version of the same thing they were familiar with, but embedded into the dashboard so that they can quickly find that. So, as we've innovated, never feel like you kind of have to hold on to the same thing. A lot of times, we started with something, our dashboard, I think there's probably about 100+ different versions of it in a folder somewhere because we've changed and upgraded and changed. And part of innovation, I think, is really being open and eager to change, taking what you've made before and the next opportunity to improve it and do it differently, taking advantage of that. I would also say it's being comfortable with failure. We've probably made at least a dozen or so different products that I can think of that are completely ready to use and are sitting there doing nothing, collecting dust because it just didn't quite work to either get people to want to buy it, buy in on it, or just the application was something that there were other important pressing matters, and by the time we got around to getting everyone to agree on something that worked, it was something that just time had passed us by and the innovation didn't stick, and so we just moved on from there. And maybe we'll repurpose it later at a different day for something else. But you got to be okay with the fact that not everything's going to last, but you got to make those investments and try. So that was kind of our lessons learned in progression. We had at least some impediments because we had existing software suites that the department had purchased that were not the Esri software platform. And so there were some objections to trying to use something different for that purpose. One of the things that helped us in terms of that impediment was the fact that we didn't have a lot of time. And so, we communicated routinely the kind of perspective that our users had more expertise in one platform versus the other. And if we were going to need to respond quickly and provide more information, that we couldn't really be forcing ourselves a direction that was going to cause additional kind of time burdens on ourselves. The other part that really helped was there were there's some interest early on in dashboards and things like that. And so one of the Johns Hopkins folks did us a huge favor because a lot of information that the county wanted before COVID really hit our county was kind of a global situation. And I remember early on being asked to make a giant map of China that we could print so that they could pin spots on the cases in China to figure out whether it's spreading there. And we were able to show them that, well, look, there's already this solution that exists that Johns Hopkins has made, and it's global and everything else. And it was, I've been to a lot of different kind of discussions where, even today I've seen a lot of dashboards that have very similar stuff on them to what we ended up making independently, and being able to show those situations where someone's made something that looks great with a platform that you have that you can just adapt. And that worked a lot. And then I think the last part was really just about, there was some kind of, I will call it kind of political considerations with mapping looking like if we used, it was really about the visualization piece. And so the aesthetic of using large red dots on a map made it look like some of our cities were failing more than others. And so we had issues with, we don't want to use a map because it's going to make highly populated areas look bad. And if we use red, it's going to mean that it looks like publicly we're kind of shaming our different city governments. And fundamentally, they still wanted location information because they asked us to make a table that had case rates by place, but it wasn't on a map. And then that obviously quickly led to every media outlet taking the numbers and making the map for us. And so what we ended up doing was really talking about it's not really that you don't want a map, it's that you don't want a certain type of map in its presentation. And so we came back with some different options where, we adjusted the color schema so that it wasn't red, because that is more harsh of a use than kind of shades of gray in terms of coloration. The other thing we did was, rather than using city boundaries early on, we used zip code and census tract, so it wasn't as prevalent that it was, well, this is the city of such and such that's failing, right? Because it's these different zip codes and census tracts that are less easily recognized as A city or B city's particular fault, so to speak. And then that kind of helped make it a little bit easier, because then it was, that political issue was addressed, but it was also that it was a more useful and functional map at a more precise level, and people got more comfortable with the use of it. I think the most valuable thing for us has just been really the opportunity to kind of start from scratch. I think with COVID, I mean, we do health surveillance, we do disease monitoring. Most of it has been on a relatively small and manageable scale. And I think being put in a situation where there's really no right answer, and there's nothing that anybody's going to say no to trying, because frankly, like the alternative is things get worse and we did nothing. And I think being in that type of a circumstance and in a crisis, nobody wants to fail in a crisis, and so there's a lot of opportunity to say, yes, let's try something else, or give up on something that we tried it and it's not making a difference, or it's just very time consuming and we're not using it. I think having that opportunity also makes it easier to then later say, well, remember when, right, we had this other situation, let's keep that same mindset and keep trying.